Hi guys, this is Dr. Bailey. So I want you to put down what you're doing, especially if you're a new parent and you're contemplating starting your child on solid foods. I'm going to go into this today to talk a little bit about the different stages. Since a lot of parents come into my office, they don't really know what the different stages are when you can start your baby on solid foods. So that's what we're going to talk about today. Just simple, quick tip, won't take much of your time. So listen up. So today we have the 3 different stages for babies to start off with food. I'm going to go through each one and just give you a little bit of information. So stage 1 foods are generally for babies anywhere from age 4 months, it says on the label, to 6 months of age. However, as a pediatrician, I recommend my patients to start really at around 6 months of age for introducing foods, just because that can decrease risk of food allergies. I want the patients who start this to have really no head lag. So what that means is that babies can sit, at least if you're holding them at 4 months of age, so that their heads don't lean forward. And for 6 months of age, so that if they're sitting up, they can just sit up kind of unsupported for a few seconds before falling forward. Again, you want your baby sitting in a high chair when you start to feed them. And the reason why there's only one ingredient is because, again, we're concerned about food allergies. And what we recommend is that any parent that's starting to feed their baby only feed their baby one ingredient at a time. So in this case, it's beech nut pear that I've purchased. You can get this at the store. There's no brand that I recommend over another. I just picked this one up just because. But the thing about it is that in this case, if you feed your baby the stage 1 food, you're going to feed it to them for 3 to 4 days. So this means that if you pick up the beech nut pear, you're feeding your child the same beech nut pear baby food, stage 1 baby food, for the next 3 to 4 days. And essentially what you're doing is you're looking for food allergies. Now, food allergies would come in the form of a rash that would really develop less than 30 minutes to an hour, but generally it's pretty quick after feeding. If this is the case, you'll give your baby some antihistamine, call your doctor as well, and then also let them know about what food that is and stop feeding your baby that food. I want you guys to also note the consistency. It's nice and smooth. Okay, so it's a nice puree. Next, I have the Beech Nut Naturals Stage 2. So Stage 2 foods are generally recommended for patients or for babies that are 6 months or older. However, again, like I said, as a pediatrician, I recommend my patients to start off stage 1 foods at 6 months of age and then to move on to stage 2 foods. I would say really about a month or a month and a half after, so about 7.5 months, just so that you can get down whether there are any allergies that your baby may have by testing those stage 1 foods, and then start moving into the stage 2s. So with the stage 2 foods, the consistency is much thicker, so this is good. The other thing to note is that this is when we start mixing things up and go a little crazy. So in this case, the Beech Nut Naturals has banana, orange, and pineapple in it. So what that means is that you have 3 ingredients. To be absolutely safe, and I'm sure you guys know what I'm going to say, you want to make sure that you tested all of these singular ingredients so that when your baby is eating, should they develop food allergies or they develop a rash, then at least you know exactly what it is that they may be allergic to. Because there's nothing more frustrating than feeding your baby something and then again not knowing what may have caused that rash. Then what we do is just kind of go down the list, try to figure it out, but it can take time. Okay, Finally, we have stage 3 foods. So really, I just kind of made this myself. It was hard for me to find stage 3 at the store, but essentially what it is, these are just pears. So essentially what they are just nice mashed up pears. But again, as you'll notice, unlike the stage 1 foods that are nice and pureed, stage 2, which is puree but a little thicker and a combination, this is more chunky. So this can also be in combination. So again, that's where you'll have your like quinoa, or you'll have even some vegetables thrown in and fruits as well. Generally, I recommend this for anywhere from 9 months of age up to 12 months of age as well. Now, I know that there are other food philosophies. Really at this age, even with stage 3, they're nice and chunky. I recommend my patients to have soft table foods or foods that are slightly overcooked, like carrots, but you want carrots to almost dissolve in the mouth, and other things. So I just want you guys to look at this, know what this is. So again, stage 1, nice smooth puree. Stage 2, thicker, right? And at this age as well, you can also throw in some cereal, whether it's like, you can even do like nice smooth grits, baby oatmeal as well. And you can even actually do baby oatmeal at stage 1 phase, but the trick is you want to make the baby oatmeal watery. Okay, then you can make the baby oatmeal at stage 2 phase or baby cereal less watery by adding less milk or less water to it. And finally, stage 3, nice thick and chunky pieces. Again, smaller pieces. Your baby most likely has 1 or 2 teeth now so that they can mash and gnaw a little bit. But again, you want to make sure still that even like with these pears, they're nice and soft. All right, guys, I hope that helps. For more information, please go to our website at www.askpeds.com and check out our YouTube channel and TikTok. Take care. For more tips and tricks for your child's everyday health conundrums, subscribe to our YouTube channel and go to our website at www.askpeds.com.